After being diagnosed with cancer and the shock settles in, most cancer survivors have this one burning question. How long does it take to recover from cancer? You want to get back to your life, right? So this is a very valid question. How long are you going to be struggling through cancer? When is all of this going to come to an end? Where is the finish line? There's actually a quite simple way to estimate your recovery time. Here's how you know how long it will take you to recover from cancer. Cancer recovery depends on a few key factors that are individualized to you and your cancer treatment. Now let's walk through each one and see how it applies to you. Here's what you need to do. Keep track of how many of these key factors apply to you. For each factor that is true, give yourself 1 point. Count on your fingers, make a mental note, or get a piece of paper. At the end, we're gonna add up your score and estimate exactly how long your cancer recovery will take. During my doctorate in cancer care, I started developing this strategy to estimate how long it would take to recover from cancer. But now, after working with over 250 women in the Cancer Freedom Program and literally thousands of women throughout the course of my career, I've proven that this is a simple strategy to estimate your specific cancer recovery time. Okay, ready? Let's go. Here are the 7 factors that will impact your cancer recovery time. The most important factors that influence your cancer recovery have to do with your specific treatment. I'm gonna walk you through the specifics of how to calculate that, but first, let's start with your life before cancer. Number 1, your age when you were diagnosed. Now, age isn't everything, but it does in fact play a role when it comes to cancer recovery. As you age, your immunity actually takes longer to recover. This can be seen with your bone marrow specifically. Your bone marrow is actually where a lot of your immune cells are created. White blood cells, platelets, red blood cells. The problem here is that chemo greatly impacts your bone marrow and hence your immunity. So your age, or more specifically, the age of your bone marrow, will actually impact how long it takes you to recover from cancer. When we look at age, here's where we draw the line. If you were over 50 years old at the time of your diagnosis, then give yourself 1 point. If you were under 50 years old when you were diagnosed, then don't give yourself any points for this first key factor. On to number 2. Now we need to consider your fitness level before you were diagnosed. Everyone comes to a cancer diagnosis at a different place in life. I've worked with cancer survivors who were very active before cancer. They ran marathons, hiked, lifted weights, were on their Peloton. And then again, other cancer survivors might have been very sedentary before cancer, mostly working a desk job like many of us do, or maybe just not having a great love for fitness, sport, or exercise. Look, we can't change what we did before cancer. We all know that. Since being diagnosed, I'm sure you've been racking your brain to think what you could have possibly done different before cancer to get a different outcome now. What could have caused your cancer? Should you have ate healthier? Should you have exercised more? Stressed less? But look, it's totally pointless to go through this in your mind. But your fitness levels before cancer does impact how quickly you'll recover from your cancer treatment. So I want you to think back to before you were diagnosed with cancer and think about how often you moved your body, you exercised, or you worked out. If you were active before cancer, then don't give yourself any points for this key factor. Active before cancer means you went to the gym on a regular basis, walked your dog every day, or maybe you ran at least twice a week. Before I was diagnosed with cancer, I was very active. My job required me to walk a lot throughout the day. I would need to move around a lot to different areas of the hospital or between hospitals to see my patients. That meant I ended up getting a lot of steps throughout the day. This is perfect for a baseline activity level, but there was actually more than that. I was also very active. I was a Team Canada strength athlete. This meant I was at the gym 4 days a week for at least 2 hours at a time. Now, this level of fitness greatly supported my cancer recovery. I quickly recovered from surgery because of the amount of lean muscle mass I had and my fitness level. So if you were active before cancer, no need to give yourself any points here. But if you weren't necessarily active before cancer but had a physical job, then I want you to give yourself 1 point. This means that you didn't necessarily seek out exercise or sport, but you had an active job. After work hours, you didn't necessarily go to the gym or exercise, but during work, you were often walking about, lifting, or moving throughout the day. If this feels like you, then give yourself 1 point. And lastly, if you were mostly sedentary before cancer, I want you to give yourself 2 points. This means you had a desk job and you were mostly sitting throughout the day, and you didn't seek out any kind of extra movement. So no walking, no sport, no going to the gym. This feels like you, then 2 points here. Okay, on to factor 3 of 7. other health condition. Now, many cancer survivors find that the first time they are actually ill is when they're diagnosed with cancer. A breast cancer survivor that I worked with had never had any other health condition before she was diagnosed with cancer. She was 52 years old. She always went for her routine checkups and mammograms, and she wasn't on any medication. No problems with her heart, no aches and pains, and she wasn't taking anything but a multivitamin. Then she was diagnosed with cancer. If this story feels like you, then don't give yourself any points for this key factor. But if you had another health condition before you were diagnosed, then give yourself 1 point here. This is a diagnosis like high blood pressure, a heart attack, arthritis, or inflammatory bowel disease. If you were actively being treated, followed, or diagnosed with another health condition before cancer, then give yourself 1 point here. Factor 4. Now we start to get into the specifics of your individual cancer treatment. The type of treatment you receive is definitely going to impact how long it takes you to recover, so these next few factors are very important. Factor 4 is chemotherapy. If you're receiving chemotherapy, then give yourself 1 point here. Now, let me clarify what I mean by chemotherapy, because this is really important to make sure you get this right. Only give yourself a point here if you're receiving IV or intravenous cytotoxic chemotherapy. This is the type of chemotherapy that targets rapidly dividing or changing cells in your body. Cells like your hair or the lining of your mouth or the lining of your gut. This does not include chemotherapy that is immunotherapy. For example, if you're a breast cancer survivor that received the red devil, then give yourself 1 point here. Factor 5 is radiation. Radiation, although a different type of stress on the body compared to chemotherapy, is still a stress and it's going to impact your cancer recovery. The most common side effect during cancer recovery is actually exhaustion, low energy, fatigue. It's exhaustion that cancer survivors actually says holds them back the most from getting back to their life, going back to work, and enjoying time with their family and friends. It's exhaustion that has the greatest impact on your life after cancer. Why radiation becomes a factor is because the #1 side effect from radiation is also exhaustion. So of course, chemotherapy will make you feel tired, but radiation is actually going to compound this even further. So if you've received radiation or you're going to be receiving radiation, then give yourself 1 point here. On to factor 6, which is if you were hospitalized overnight. Let's clarify this one too, because there's an important distinction before you give yourself a point. Only give yourself a point here if you were hospitalized from a complication of your chemotherapy or treatment. This means no point for you here if you were hospitalized for a surgery or as part of your routine chemotherapy. Only give yourself a point here if you were hospitalized because of a complication, an infection, a blood clot, or an allergic reaction to your chemotherapy. Give yourself a point here if any of these apply to you. Factor 7 is oral cancer treatment. Now, most of my hormone-positive breast cancer survivors are going to be giving yourself a point here. If you are planning to or taking a drug like anastrozole, letrozole, exemestane, tamoxifen, then give yourself a point here. But this also includes other types of oral cancer treatment, drugs like Xeloda or capecitabine. Any oral medication that is designed to treat or prevent your cancer from coming back, then give yourself a point here. Reason why is because these drugs come along with side effects, and pretty significant side effects too, might I add. These side effects absolutely impact you as a cancer survivor, and if they're not well managed, then they can significantly delay your cancer recovery. Without a proper plan to actually address the side effects of these oral medications, I've witnessed many women's cancer recovery drag on for years. Okay, so now tally up your score and let's see how many points you ended up with. Now, we want to look at the average time it takes to recover from cancer and then use this point system to make it more personalized to you. The average time it takes to recover from cancer is twice the length of time of your treatment. For example, if you received chemotherapy and radiation for 6 months, then the average recovery time will be 12 months. It's a long time. A year of recovery? Yikes. Personally, I received treatment for 4 months, so the average length of recovery time would be 8 months. But now let's add in your specific points to get a more personalized cancer recovery time for you. If you had 7 or more points, then add 6 months of recovery time to your average. If you had 4 to 6 points, then add 3 months. If you had 2 to 4 points, then add 2 months. And if you had 1 to 2 points, then add 1 month. This means if you were treated for 6 months, then your average recovery time would be 12 months. But then based on your personal factors, your recovery time could be as long as 18 months. If you're anything like me as a cancer survivor, then you're probably thinking that this length of time is just way too long until you'll feel recovered from cancer. As a cancer survivor, your main focus needs to be on cancer recovery, exercise, and mindset. But the number one place to start with your cancer recovery is your food. That's exactly why I've linked up this next video here. If you want a shorter cancer recovery time, then you need to watch this next video. Okay, I'll see you in there.